Hello friends, Namaste. So now we come to another medical system for energy healing, that is called Qigong. I mentioned it too. Qigong means mastery of energy force. So let's see Qigong in detail. Qigong, pronounced as Qigong, is a TCM, traditional Chinese medicine healing practice, that is believed to support mental, physical and spiritual health through gentle movement, meditation and breathing technique. All three things are together. Gentle movements are there, meditation is there and breathing technique. While there are many ways to practice Qigong, there are basically two main categories. Active Qigong means dynamic, with full force, hard force, and passive Qigong, soft force. Active Qigong uses controlled, slow movements, while passive Qigong involves stillness and calm breathing. Regardless of the form of Qigong, the goal is to allow energy to freely move throughout the body and reconnect with the earth for healing. That earthing must happen with the earth. Then only healing can start taking place. We'll see Qigong in basically two parts. Part 1, what is Qigong? And part 2, certain frequently asked questions we'll just see. What is Qigong? You can see a gentleman moving forward with two hands forward with a proper concentration in his eyes, moving, slow movement with concentration. Technique. Qigong meditation is an ancient Chinese healing practice that combines controlled breathing, gentle movement and meditation to promote good mental, physical and spiritual health. Similar to Tai Chi, Qigong meditation is believed to treat a variety of health conditions, including high blood pressure, heart disease, diabetes, chronic fatigue, insomnia and leg and pain, among others. Yet research backing these claims is very limited. That's a caution. Scientific research backing these claims is very limited. Qigong offers many benefits. Some of them are backed by research, including improved balance and gait, as well as reduced stress levels. Other purported benefits include a lower risk of chronic disease and improved focus. Now, you must be wondering, what is Qigong meditation? On one side, you are saying Qigong is basically movement with the breathing techniques. How both these things, movement plus meditation, go along? Qigong meditation, ancient Chinese healing practice. Qigong, it is roughly translated as the master of one's energy and combines two important concepts of traditional Chinese medicine: vital life force, Qi, and Gong means mastery or cultivation of a particular force. This practice is meant to cultivate the energy and strength of nature into one's body to promote better mental, physical and spiritual health. In traditional Chinese medicine, poor health is a result of blocked energy that flows through the 12 meridians or sections of the body. Thus, Qigong is believed to promote health by allowing your energy or Qi or Prana to flow through the body. Qigong is popular in China for exercise, recreation, relaxation, preventive medicines and physical and mental healing. Plus, it is even employed in martial arts training. Despite its widespread use, research to support the theory of Qi energy is lacking. This is a martial posture of Qigong. Types of Qigong meditation. While there are many ways to practice Qigong, basically there are two main categories: active, that is dynamic, and passive. Active Qigong uses controlled slow movements, while passive Qigong involves stillness and calm breathing. Qigong can also be practiced internally by yourself or externally via a Qigong therapist. With external Qigong, a therapist provides emitted Qi to promote healing. Though for most people, Qigong is a self-healing technique that is practiced without a therapist. Regardless of the form of Qigong, the goal is to allow energy to freely move through the body and reconnect with the earth for healing. These are the old-time pictures of Qigong, centuries old. Active dynamic Qigong. Active Qigong, also known as Dong Gong, involves intentional active movement and breath work that enhances your energy. In traditional Chinese medicine, Yang represents active service, active energy, strength and vibrancy, while Yin depicts passive energy, calmness and gentleness. Yang, active energy, and Yin, passive energy. It includes repeating gentle coordinated movements to promote blood and lymphatic drainage, balance, muscle strength and flexibility, and a greater awareness of one's body in space, known as proprioception. This type of Qigong is considered exercise but shares mutual characteristics with passive Qigong, such as good posture, controlled breathing, focus on relaxation and visualization. This is active Qigong. From the posture itself, it is dynamic. It gives that picture of little bit of martial exercise. Here also you can see how this girl, in what posture she is in a ready position to strike someone or to defend herself. Here also boys are learning Qigong with the use of hand. Now coming to passive Qigong. Passive Qigong focuses on embracing Yin. Yin means passive energy. Yang means active energy. Yin means passive energy. Through body stillness and the mental cultivation of Qi energy. During this form of Qigong, the body is not moving externally. The body is not moving externally, but the mind is actively working to cultivate and move Qi energy throughout the body. This practice would be similar to traditional meditation, passive Qigong. Benefits of Qigong meditation. Qigong offers many benefits. Some of them are backed by research, including improved balance and gait, as well as reduced stress levels. Other purported benefits include a lower risk of chronic disease and improved focus, increased balance. Qigong focuses on controlled, slow movements of the body to improve your proprioception or awareness of your body in space, which helps increase balance, muscular strength and flexibility. There is a study of 2020 in which 95 adults ages 51 to 96 they participated, and they had significant improvements in balance and gait, walking scores. Interestingly, Qigong can also improve balance in your adults, balance in younger adults. Considering that all age groups can safely participate in Qigong, it may be an effective and enjoyable strategy to improve balance and lower the risk of the falls. Increase balance. See the way the gentlemen are standing on one leg and trying to check the balance. Lower stress and anxiety. Qigong involves meditation, controlled breathing and gentle movements, all of which have all been shown to help lower stress and symptoms of anxiety. Calm, controlled breathing tells your body there is no immediate threat and activates the parasympathetic nervous system, the rest and digest system. It also slows your body's stress response system known as the hypothalamic pituitary adrenal axis. Also incorporating Qigong into one's daily or weekly practice has been linked to greater quality of life due to less stress, greater self-efficacy, and better physical health. Still, higher quality studies are needed. By incorporating Qigong into your weekly or daily routine, it may help you better manage the daily stressors of life, lower stress and anxiety, may lower risk of chronic diseases. Qigong is a gentle form of exercise and emphasize calm and meditative breathing. Together, this may reduce stress on the body, increase blood flow, and improve your overall fitness, all of which can lower your risk of chronic disease. In particular, Qigong has been shown to lower the risk and improve systems of type 2 diabetes and heart disease. Still, researchers urge that the larger, more robust studies are needed before Qigong can be recommended as a standard treatment. Remember this, Qigong cannot be recommended as a standard treatment for diabetes and heart disease because larger or more robust studies are required. That said, most people can safely practice it in addition to their current medical treatments prescribed by the healthcare providers. May lower risk of chronic disease, may improve focus. I written may here because research materials are not available. They cannot say that. So, therefore, it may improve, may not improve. Many people struggle to focus on tasks due to the busyness of day-to-day life. Qigong requires focus of the breath, mind and body. Through regular practice, Qigong may help improve your ability to focus and concentrate by helping you learn to regulate thoughts in a more productive manner. Despite the many benefits of Qigong, higher quality research studies are needed. You can just see how focused they are, looking just forward. Summary. Health benefits. The benefits of Qigong include improved balance, greater mental focus, lower levels of stress and anxiety, and decreased chronic disease risk. So many people report the benefits of Qigong. Larger studies are needed. How to do it? When learning active Qigong, it is best to visit an in-person class to learn the sequences correctly and build a sense of community. You can also watch beginners videos online. For passive Qigong, try adding 10 minutes of meditation per day to your routine. How to do it? Dozens of variations of Qigong to get started. Here is a basic guide for passive and active Qigong. However, before beginning any new exercise routine, it is best to speak with your healthcare provider. Passive Qigong. Passive Qigong is very similar to traditional meditation. Two main types of passive Qigong exist: mental focusing, rouging, and visualization. Concept. Mental focusing. To practice mental focusing, simply sit in a comfortable upright position, close your eyes and breathe in, out. Close your eyes and breathe in and out with your belly, diaphragmatic breathing. Ideally, try to sit for at least 10 minutes or longer and focus on your breath. Passive Qigong. Visualization. This involves a similar practice but with added imagination. With your eyes closed, imagine things that bring you joy or relaxation. Use this visualization to help direct positive energy throughout your body. You may also visualize energy going towards an organ or area in the body that requires healing. To enhance your practice, attend classes or read Qigong guides to learn chants, visualization, and other meditative techniques. The goal of active Qigong is to continuously keep your body in flow. Unlike yoga, which generally focuses on static stretches, active Qigong requires you to keep your body moving through various movement sequences. Since Qigong involves a sequence of movements, it is best to start with a beginner's class or online video. Ideally, active Qigong is practiced in a group setting to promote connectedness and community, which traditional Chinese medicine believes is important for health and healing. With either passive or active Qigong, remember to practice patience while you learn and enjoy the process. The bottom line, takeaway, Qigong is a meditation and healing practice that has been part of traditional Chinese medicine for centuries. Benefits of Qigong include lowered stress and anxiety, increased focus, and improved balance and flexibility. It may even reduce your risk of certain chronic diseases. Nevertheless, more high-quality research is required. Most forms of Qigong can be practiced by people of all age groups and conditions. It can be practiced by all age groups. However, if you have a chronic illness or injury, it is best to speak with your healthcare provider. Ask your doctor before introducing any new form of exercise to your regimen. If you are interested in calming your mind and body, you will want to give Qigong a try. Courtney Sullivan, certified yoga instructor. Now let's come to frequently asked questions, very interesting questions. Of course, there will be certain repetition also, what we learnt in part 1. But because of question answer techniques, it is easy to assimilate for you people. And meanwhile, in last half an hour, some of you might have got certain doubts. And I believe, I hope that those doubts will be answered in this part 2. Number 1 question, what is Qigong and how does it work? Qigong, pronounced Qigong, was developed in China thousands of years ago as part of traditional Chinese meditation. It involves using exercises to optimize energy within the body, mind and spirit with the goal of improving and maintaining health and well-being. Qigong has both psychological and physical components and improves the regulation of the mind, breath and body's movement and posture, gait. In most forms of Qigong, breath is slow, long and deep. Breath patterns may switch from abdominal breathing to breathing combined with speech sounds. Movements are practically gentle and smooth, aimed for relaxation. Mind regulation includes focusing one's attention and visualization. What is Qigong and how does it work? Dynamic or active Qigong techniques primarily focus on body movements, especially movements of the whole body or arms and legs. Whereas meditative, that is the passive Qigong, techniques can be practiced in any posture that can be maintained over time and involve breath and mind exercises with almost no body movement. Is Qigong the same as Tai Chi? Tai Chi, yes, after this particular lesson we are going to study Tai Chi, but still some introduction here. Tai Chi originated as an ancient martial art, but over the years it has become more focused on health promotion and rehabilitation. When Tai Chi is performed for health, it is considered a form of Qigong and involves integrated physical postures, focused attention and controlled breathing. Tai Chi is one of the hundreds of forms of Qigong exercises that were developed in China, old China. Other forms of Qigong include Baduan Jin, Lijuji, Huye, Xian, Yizin Jing and medical Qigong. Can Qigong reduce pain? The research on Qigong's role in pain is conflicting. 3 reviews from 2018 and 2019 that looked at only a small number of studies suggested that Qigong may help to decrease pain in community dwelling older adults. It may decrease pain in older adults. Neck pain, musculoskeletal, all these things it may reduce. But a 2020 review that included 5 studies found conflicting results on Qigong's pain reducing effects for low back pain and neck pain. So overall, we can't say that Qigong can reduce pain. It may or may not. Is Qigong helpful for people with chronic diseases? It is helpful in the following chronic diseases: fibromyalgia, a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Chronic obstructive pulmonary disease, Parkinson's disease, high blood pressure, and chronic heart failure. Can Qigong help older adults? The number of Qigong studies that have included older adults is limited, very limited. 2 reviews had taken place in 2019, looked at the effects of Qigong on the physical and psychological health of older adults. Some of the results are positive, suggesting a potential benefit of Qigong for older adults. A significant positive effect on the quality of life, but not on depressive symptoms. This was the finding of earlier studies. The second review looked at 14 studies, and the second review found that Qigong helped improve physical ability and may have positive effects on depression, balance, and functioning. But the researchers noted that more methodological sound randomized control traits are needed to determine the efficacy of Qigong on physical and psychological health in older adults. Number 6 question, can Qigong help prevent falls? 2019 survey of reviews found sufficient evidence to support Qigong for balance training and fall prevention. When compared to more traditional intervention, Qigong was found to have similar and sometimes better effects. Will Qigong help with knee osteoarthritis? There is only a small amount of research on Qigong's effect on knee osteoarthritis. 2020 review, and the review found that Qigong improved pain, stiffness, and physical function more than a waiting list control or a health education intervention. Because the evidence was weak, however, the author said that Qigong cannot be recommended until more high quality studies are done. In 2017 clinical practice guidelines published by the Ottawa panel, they recommended using a Tai Chi Qigong program for improving quality of life in people with knee osteoarthritis. The guideline author suggested that the Tai Chi Qigong program might also be beneficial for pain relief and improving physical function. Can Qigong help to manage symptoms in people with cancer? Can Qigong help the cancer patients? 2019 review, Qigong significantly improved symptoms of fatigue and sleep quality only. Though not satisfactorily significant, Qigong and Tai Chi also had positive effects on anxiety, stress, depressive symptoms, and overall quality of life. So, yes, it can manage symptoms. Yes or no, 50-50. 2017 review, the review found that using Qigong was promising for managing physical and psychological symptoms related to cancer and its treatment. Can Qigong improve cognition and memory? Only a small amount of research has been done on Qigong's effect on cognition and memory. 2020 review, that's a review of 2020, and it says that Qigong improved cognition and memory after 3 and 6 months of practice. 2019 review, in that review and again in the review of 2020, Qigong was found to improve cognition and memory, but only when at least one of the following was true. The length of the program was longer than 12 weeks, more than 12 weeks. 12 weeks means almost, not almost, it is 3 months. 3 months program, 3 months of exercise in Qigong is required. Exercise frequency was 3 to 7 times per week, but the duration of each exercise session was 45 to 60 minutes. Qigong helps with mental health in substance use disorders. 2020 review, Qigong appeared to have a more positive effect on reducing anxiety than medication or no treatment. Yes, the review said it had a positive effect. The review also found that Qigong led to significant improvement in depressive symptoms. Can Qigong help people who have COVID-19. The amount of research on Qigong for COVID-19 is extremely limited, so we just cannot say anything. There was a 2021 review after COVID was over. Qigong had not been well investigated as a treatment for COVID-19. 2021 review looking at complementary therapies and COVID-19 listed only 2 very small studies on Qigong. The studies suggested that Qigong improved physical activity, perceptions of difficult breathing, quality of life, and some measures of inflammation in the body, but the studies were not randomized controlled trials. Can Qigong help people who have COVID-19? The 2021 review did not include a small 2021 randomized controlled trial of 128 participants. This study found that adding a rehabilitation program of acupressure therapy and Qigong exercise to standard care shortened hospital stay and improved lung function and symptoms such as shortness of breath and cough. So it did improve some of the patients who were hospitalized during COVID. Is Qigong safe? Qigong appears to be a safe form of activity. Many studies have indicated no negative side effects in people practicing Qigong, including people with chronic diseases and older adults. Is it safe to do Qigong during pregnancy? There is no research on the safety of Qigong during pregnancy and extremely limited research on practicing Qigong while pregnant. Pregnant women should talk with their healthcare providers before starting Qigong. It is better to take the advice from a medical doctor. What kind of training, licensing or certification do Qigong instructors need to practice? Qigong instructors don't have to be licensed, and the practice is not regulated by the federal government or individual states. There is no national standard for Qigong certification. Various Qigong organizations offer training and certification programs with differing criteria and levels of certification for instructions. Tips to consider. Don't use Qigong to postpone seeing a health care provider about a medical problem. So my dear friends, please go to a medical doctor whenever you have a problem first. Ask about the training and experience of the Qigong instructor you are considering and take charge of your health. Thank you. Thank you very much.